My name is William Kiefer. I'm 29 years old. I am a registered nurse, having graduated from the UTEP Fast Track program. Tell you a little bit about myself. I am married. I've been married for about 7 years now, and I have 3 wonderful children. My wife's name is Jasmine, and we've built a wonderful family together. We have 3 children. I have twins that are 4 years old, Ethan and Madison, and we have a new addition to our family. Her name is Sophia, our little baby girl. She's about 8 months now. My first memory of what I wanted to be when I grew up was a bagger at a grocery store. I remember being at the grocery store with my mom and thinking that was really, really neat. As I grew up, I realized that I wanted to be a physician. I wanted to join the healthcare industry. What I originally went to college for was a microbiology degree. I did that so I could further my education and become a physician and join the healthcare industry, which is ultimately what I wanted to do. So after I graduated with my degree in microbiology, I took some time off. I was trying to decide what I was going to do, where I was going to go to school. A friend of mine bought a small business here in the city, and I had the opportunity to run that business for him for about a year. And in that time, I was making some decisions personally and professionally, and subsequently I joined the Fast Track program at UTEP. I became a nurse, and I was pursuing my education in nursing because it provided the foundation that I needed. As a husband, as a father, as a provider for my family, I needed a career that was going to provide stability for me. And nursing is that career, because there's a high demand for nurses, there's a shortage in nursing, and I knew that no matter what, even if I didn't pursue my other educational and professional aspirations, that I knew that I would always have nursing to fall back on. And it's just a great career. When I finished my first degree and I realized that I was not going to reapply to medical school, I had heard that UTEP was going to offer a fast track program. And so I called, and I was told initially that the program was in the works and it would be ready in about another year. In the meantime, I applied to Trinity in San Antonio, and I was going to get a master's in healthcare from Trinity. And right before I was going to leave, I had this feeling that I should call UTEP back. And when I did, I was informed that they were about to begin their fast track program, the first class, and went through the motions with Dr. Lyon and sent her my transcript. She reviewed it, and before I knew it, I was joining the fast track class. So it was a fast transition, but a good one. I chose UTEP and the fast track program there because it's local. You know, I'd already attended UTEP. I received a very good education in my first degree. I was ranked for medical school, so I thought that was great. And I know a lot of nurses that came out of the nursing program at UTEP, and they're successful in their careers. They're good at what they do. The Fast Track program has prepared me to become a nurse because they provided me the education that I needed. There were sim labs where we could go in, we could use our stethoscopes, you know, kind of do patient care in a simulation atmosphere. Also, the instructors, Lisa Hennessy, Dr. Lyon, they're so knowledgeable, they're prepared, and they provided us with everything that we needed, really, to come out and be good clinicians. You know, going through the Fast Track program was a challenge. It's very fast-paced, and so there's a lot of things that factor into being successful. Most of us going into the Fast Track program had families, had a career, and so we have some baggage with us. You know, we're not just coming out of high school. My time at UTEP and the Fast Track program was, in my memory, a great time. It was very challenging. We relied heavily upon some of our instructors. Dr. Karen Lyon, the program director, was always there. She could counsel with us, give us the information that we needed so that we could know what our next step was, what we needed to do. Nina Williams, Lisa Hennessy, who is an instructor and a friend of mine, probably the rest of my life. You know, they just provided such a network for us as we, as students, progressed through the program. There were different challenges that we needed to overcome educationally, also in our personal lives. They were always there for us to help us work through the difficult times. I remember being in Lisa Hennessy's class for hours and hours and hours, and she would interject humor, she would interject experiences from her own professional career that would bring nursing to life for us. And I hold her in such high regard and esteem because she brought nursing off the pages of the book for us as we sat in class and made it real. And for that, she's just such an asset to UTEP and to us as students. You know, the Fast Track program is a very demanding program. We started in the summer and we were doing 12-hour lecture days. And if you can imagine starting your day at 7 a.m. and going straight with just a lunch break for 12 hours, it's very challenging. So the pace is one of the most challenging things, having to keep track of that. And after leaving a 12-hour lecture day and then having to go home and study and prepare for an exam or a quiz, and then the balance of doing school, you know, together with trying to remain a good husband and father. It was a big challenge, but those who made it were successful in managing in time management, and we pulled through. You know, as I said earlier, I have a lot of good memories from the Fast Track program at UTEP, but being that it's fast and it's such a high pace to learn at, there are challenges that are going to come along. You know, personally, I'm a husband, I'm a father of infant twins at the point when I was going through the program. It was challenging many times to keep a balance, you know, but I had a great support system. My parents, my in-laws, my wonderful wife Jasmine really supported me there as I went through the program, and as a result I was able to be successful. When I finished the Fast Track program, the first thing that I had to do was pass my boards, and I did. And then I started as a graduate nurse in a cardiovascular intensive care unit here in the city. I worked there for a year, recovering open hearts and taking care of critically ill patients with a whole bunch of different diagnoses. It was very challenging. That's what I enjoy in nursing, is to have very challenging patients. And then from there, after about a year at the bedside, I interviewed for and was hired to be the clinical coordinator over the cardiovascular service line. And my role as a coordinator was to, well, first I cross-trained to the cath lab where we do cardiac interventions for patients that are having heart attacks. So that's a high-pace, kind of high-stress area. Also, I was providing education to the nurses that worked in the cardiovascular ICU, and I also staffed in when necessary in the cardiovascular ICU and in the cath lab when it was necessary. Recently, I furthered my career, and I was hired as the director of the surgical orthopedic unit at Sierra Medical Center. Very proud to be part of this team. It's a big challenge for me professionally. I am responsible for a unit that has about 60 beds, so it's very busy, lots of activity up on this unit. Fortunately, I'm surrounded by a great team of nurses that are committed to their patients, and we're successful in providing excellent quality of care for these individuals that are here. If you're looking for a career that's challenging and rewarding, also a career that will provide stability for you, nurses are in great demand, and the prediction is that we're going to need more nurses as time goes by. So it's just a great career to come into. You know, you have the opportunity to touch people's lives on a daily basis. Many times we're helping people that are in crisis situations. You know, they're having surgery and they're in pain, and we as nurses have the opportunity to go in and to provide them care and comfort, compassion. And you know, at the end of the day, when you go home and you think about the things that you've done and the help that you provided for these individuals, you're able to feel good about what you've done. And that's what nursing as a career provides for all of us who are in this industry. If I had to provide one quote that would sum up my experience in the nursing program at UTEP, it would be that I didn't say it was going to be easy, but it would be worth it in the end. You know, it was a very challenging coursework. There's a lot of time that we spent in the classroom, in sim labs, and studying individually and in groups. So it wasn't easy, but you know, now it's been completely worth it. I've had a great career to this point in nursing. I've been able to touch many lives. Also, professionally, I've been able to move into a position where I wanted to be. I wanted to be a hospital administrator, and now I'm a director over a unit. It's challenging, and I look forward to building on my foundation in nursing, what I was able to achieve and gain from the Fast Track program.